We're going to get started. I wanted to welcome everyone, as usual, to the webinar. For those of you who don't know me, my name is Dr. Lauren Levine. I have been hosting and moderating these webinars for a little over 10 years now. Always get great turnout, especially when Dr. Madrigal's here. We've got about close to 600 people registered. As I've been doing for the last number of years, I always start by saying I hope everyone's staying safe and healthy out there. I commend you, as always, for continuing your dental education. Even though certainly dentistry has been up and down over the last few years, the need for education has never ended. And of course, you all know that because you're here. I'm going to do a little bit of housekeeping just for a couple of minutes so that Dr. Madrigal can have as much time as he needs. Many of you have been on these webinars in the past, so you know the format. Our speaker will typically speak for 45 to 55 minutes, give or take. We want to leave time at the end for a Q&A session. With this many people, we obviously can't have people asking verbal questions. It would be a madhouse. So on your screen, you should have a GoToWebinar control panel. You type in your questions as you think about them. I will get to them at the end. I try to be respectful of everyone's time, including Dr. Madrigal's. We can't do 2 hours worth of Q&A, but usually we can get to all the questions for these webinars. If for some reason I have to cut it off because we have too many questions, I apologize ahead of time. I see all the questions as they come in, so a lot of times I can combine some of them together and be able to make sure that we get as many questions answered as possible. In the next few days, look for a couple of things. First off, as always, I record the webinar. You will get an email link to download that recording. Typically, that goes out within about a day or so. So, if for some reason you can't stay to the end or you got to check something else when you're online, no worries. You can download the recording when you get that link and view it as many times as you want. Have your staff look at it. It's there for your use. During the webinar, Dr. Madrigal is going to show some of the systems and products that he uses, which are exclusive to TDSC. I want to thank them for their sponsorship of these webinars. They're the ones that are bringing in these great speakers and help to make sure we got the best content that's going to be valuable to everyone. For the CE, DenMat is actually handling that this evening. I always get emails after the webinar asking about the CE, so I try to mention it at least 2 or 3 times. I know some people still aren't logged in yet. But with CE, an hour or so after this webinar ends, you're going to get an email that has a very short survey. It's about 2 to 3 minutes. I think it says 5 to 7 minutes. No one takes that long. It takes like 2 minutes. If you want to get the CE, there's a few conditions you have to meet. First off, you have to fill out that survey. Like I said, it only takes a couple of minutes. You have to be here live. If you're watching this recorded, unfortunately, we have no way of tracking who's watching recorded webinars. So you have to be watching it live, and you have to have been here for the bulk of the webinar. Obviously, if you only log in for 4 minutes or 5 minutes or whatever, you can't get the CE for that. But as long as you're here for the bulk of it, like 40, 45 minutes out of the 60 of the presentation, you will be sent that. That typically can take about a week, maybe a little bit longer. So please be patient. For some reason, a lot of times those end up in people's junk or spam folders. So keep an eye on that. If you don't have your form, say by a week from Wednesday, by all means, feel free to reach out to me. I'll follow up with DenMat to make sure you get it. So with that out of the way, we have had the pleasure of having Dr. Madrigal speak a number of times in the past. For those of you who don't know him, he is a restorative and implant dentist. He has dental practices both here in California and Mexico. He graduated from the University of La Salle in Lyon, where he got his DDS. He is a faculty member of the American Academy of Implant Dentistry. He's a member of the American Academy of Cosmetic Dentistry. If you are in dentistry, you probably know who he is because he is a well-recognized speaker, lecturer. He gives presentations both domestically and internationally on just a bunch of subjects, which he's also shared with us on a number of these webinars. Subjects like implant dentistry and laser technology and clinical photography, minimally invasive veneers. He's one of those dentists who just believes that paying attention to the details is really what separates good and great cases. So, Dr. Madrigal, as always, we're thrilled to have you back and looking forward to the presentation.
Thank you, Dr. Levine, and thank you everyone else for joining us tonight. So we have only about 45 minutes that we're going to be sharing tonight. So hopefully we can get through a lot of material. Again, if we have any questions at the end of the webinar, feel free to either send me an email or send me a message through Instagram. This webinar tonight is the second part of a 3-part series that we're doing with TDSC. So the first part was really just an introduction to lasers. The second part, which is today, is going to be about how we can manage soft tissue, especially periodontal therapy, with the laser, and how we can incorporate lasers into our practices in order to help our patients be more healthy and also to increase office profitability, as well as decreasing chair time. So that's going to be the second part, which is going to be today. And then on November 14th, if I'm not mistaken, November 14th, we're going to have the third part of this webinar series, which is going to be about restorative dentistry. So how we can use the lasers to diminish or decrease our chair time, make sure that our procedures are more predictable, and just overall have a better restorative outcome. So with that out of the way, let's go ahead and start with the objectives. So the first thing that we were going to do when we're done with this webinar, it is my goal to have everyone here be able to understand and explain the fundamental concept of periodontal soft tissue management. Specifically, we're going to be dealing with periodontal therapy, so scaling and root planing, how we can use a laser to decrease the bacteria that are around the sulcus, that are in that crevicular fluid, that are embedded in that periodontal tissue. The second objective is going to be that I want you to be able to identify and evaluate the indications and contraindications of different types of laser techniques in periodontal therapy. So we're going to see 2 different techniques, which most of the offices that are watching right now was probably just doing traditional SRP. So we're going to be talking about that. We also want to learn and integrate the principles and methodology of Visalite cancer screening. That is something that's it's been growing more and more in the dental field, but unfortunately we're still lacking in that. More offices are now doing cancer screening on other patients, but it's still not the majority of them. So if your office is not doing cancer screening yet, that's definitely something that we need to be implementing for every single patient that walks into our office. At least for new patients, we want to make sure that every patient is being screened, because we know that cancer screening can really help save a life. And that's something that we're going to be talking about too, how we use the Visalite Pro, which is fluorescent light, in order to aid us. And the technology that we have now available is so advanced that there's really no excuse for us not using this cancer screening tool that we have in order to make sure that we really inspect the soft tissues, that we're really checking to make sure that our patients are healthy, not just from a periodontal point of view, but just overall health systemically. Like I said, the fourth objective is going to be able to demonstrate the techniques of performing SRPs using traditional and laser-assisted methods. So that's going to be the bulk of the presentation, is really how we can use lasers in order to assist us with SRPs. What are the outcomes? What's the reasoning behind using a laser? How fast is it? Like, how much time do we have to spend on this? Like, what's the initial investment? Is it something that the dentist has to do, or something that the hygienist has to do? So all these questions hopefully will be able to be answered throughout this webinar. And if not, again, at the end, we can answer questions. And if we don't have time, just go ahead and shoot me an email. Finally, probably the most important thing of the webinar is being able to communicate with our patients. When we educate our patients, we do 2 things. One is that we are able to have an increased long-term compliance. So the compliance rates will increase if the patient is educated. And the second one is that we're going to have greater case acceptance. So if we have greater case acceptance, it's because the patient understands the treatment that they're getting. And this is something that I can apply directly into my life, where when I used to go to the dentist when I was a child or even a teen, I had no idea what was going on, because unfortunately it was just never explained to me. And That's something that we can capitalize on. There's many offices that really don't have good and effective communication skills. So if you're the office that stands out because you're able to communicate with your patients, if you're able to explain the treatment in words and terms where they understand what's going on in their mouth, why they need the treatment that you're prescribing, that you're recommending, that is going to go a long, long way. So with that out of the way, let's start with just the fundamentals of periodontal of the periodontal complex, or the periodontium. So the way I like to explain it to my patients is like this. In very simple terms, we have two areas of the tooth. We have the outside that you can see, which is called the crown, and we have the root, which is embedded in the bone, in the jaw. So that's it. We have two parts, the root and the crown. So the root is going to be surrounded by three things. The part of the tooth is that's called cementum, and the part that attaches that cementum to the bone, which is the periodontal ligament. So we have these three things: cementum, periodontal ligament, and alveolar bone. So these are the supporting structures that are going to hold the teeth in place. And we have to be able to understand the role in their overall health. If we have this complex that's completely healthy, that means that we're not going to have any bleeding. We're going to have good aesthetics as well. So overall, it's just something that we need to take care of. So what happens when we have an infection? Well, if we have a severe infection, what happens is that chronic inflammation will start eating away at this bone, eating away at this periodontium. So little by little, the teeth will start looking longer because the crown will now be bigger, or it will appear bigger because now you're seeing part of the root as well. And if this continues little by little, it's not something that happens overnight, but it's a chronic inflammation, chronic infection that we have. If this continues and progresses, our teeth start shifting. We start getting those black triangles, and then at the end of the day, we're not going to be able to keep those teeth in our mouth. We're going to lose those teeth. So it is extremely important for us to be able to take care of this complex that we have that's holding our tooth in place, that's holding our tooth to the bone. And it's also going to have a huge role in aesthetics. When we're talking about aesthetics, like in this case right here, we need to make sure that we have a strong foundation. If we're maintaining healthy tissues, then we're able to do restorative work as well. This patient, we simply did some veneers. We did 10 veneers on the top arch to change the form of those teeth. But we can see that we have a healthy periodontal tissue. Without a healthy periodontal tissue, we're not going to be able to do restorative work. Why? Well, because the chronic inflammation is simply not going to be able to allow us to give us good aesthetics. So it's important for us to always have a strong foundation. If we have a strong foundation, we're going to have long-lasting results. In this case, again, we see that we have the gum health and the smile aesthetics, and we see how the gingiva is able to frame the teeth. And it's going to be an integral part of just the overall beautiful smile. When we have healthy and well-contoured gums, that's going to contribute to the overall just harmonious appearance of the smile. Now, if we have diseased or irregular gum tissue, that's always going to take away from that smile. But not only that, if we don't have a strong foundation, the way I communicate this to my patients is, if we don't have a strong foundation, it doesn't matter what type of work I do, it's going to fail. So I use the analogy of building a house. If we have a strong foundation, we can build a beautiful house on top of that foundation, and we know that it's going to last a long time. If we have a weak foundation, it doesn't matter how beautiful of a house we build, it's not going to last because it's sitting on something that's not stable. So the same way with our restorative work, if we do all these beautiful veneers, these beautiful crowns, but we don't have a strong foundation, it's not going to last. Little by little, you're going to have recession, you're going to have those black triangles show up, you're going to have loose teeth, and our work is going to fail because we are not controlling that chronic inflammation, because we're not focusing on having a strong foundation. So the first thing we need to have is a strong foundation in order for us to have long-lasting aesthetic results. So if a patient is looking for aesthetics, we need to have a strong foundation. If a patient is only looking for function, we still need to have a strong foundation. So the way we communicate this with our patients is going to help them understand the process a little bit better and overall just accept the case and accept the treatment that you're giving them. So if we're talking about harmonious look, what does the tissue actually do? So what are the common soft tissues issues that we have? What we were presented with? Well, if we have just a little bit of inflammation, we're going to have gingivitis. And that's going to be the most common problem. That's going to be gingivitis or periodontitis, where we have some bone loss now. And this periodontitis can cause just more and more chronic recessions. We can have bone loss. That bone loss is going to lead to black triangles. We can have bad breath and eventually tooth loss. But it's important for us as dentists to also be able to diagnose correctly. If I show you this picture right here, or I show a patient this picture and I tell them, you know, this is happening because you have gum disease, you have periodontal disease. That's why you have all these recessions. And we're going to have to do some grafting, some tissue grafting, and you need to get SRPs, and we're going to use a laser on this and get you back to health. Well, what's going to happen? I failed to diagnose this problem correctly. Why? Because we see that this recession and these infractions are not due to chronic inflammation. They're more likely due to trauma. So we have occlusal trauma, we have malocclusion, and that's really what's causing this recession. So it's important for us to be able to diagnose correctly. If we're diagnosing periodontitis, we want to make sure that we have those pockets, that we have bleeding on probing, and that overall we just don't have healthy gums. If we have a case like this and we do SRPs with the laser and we do Peri-Restore, it's not really going to be a service to a patient because we're not seeing what the cause of that recession is correctly. So we need to be able to diagnose correctly. Now, granted, this is going to be not very common when we're talking about periodontal therapy. When we see a case like this, we immediately know what's going on. But just overall, it's just to show you the importance of being able to diagnose correctly. This leads me to think, well, we have to probe every single patient. We have to see all the teeth. All the teeth need to be probed in 6 different places, 3 in the lingual and 3 in the buccal. If we do that, then we're going to be able to have that data. Look at that data and see how many pockets do we have. The more bleeding that we have, the more pockets that are above 3 millimeters, the higher that risk and the more likely that that patient is going to develop a more severe periodontal problem. So we're talking about lasers, and what can we do then when we're talking about maintaining that soft tissue? If we're going to talk about lasers, we need to know that there's different types of lasers, but let's have just a short intro to what lasers are. So what do lasers do? How are they used? In dentistry, it's really just going to be a beam of light that's going to be focused in one little tip, one little area, and it's going to turn that light into heat. And that heat is what's going to give us all the properties that the laser has, whether it's cutting tissue or whether we're using it to decrease the amount of bacteria around the tooth, whether we're using it for hemostasis or nerve cauterization. Whatever it is that we're using, it's all dependent on that amount of heat that's going to be at that tip of the laser tip. So they're used in dentistry for many applications. We can use them for soft tissue, we can use them for hard tissue. In this lecture today, we're going to focus only on the diode lasers, which are only soft tissue lasers. That means that they're not going to be cutting tooth or bone, but they're also not going to be damaging tooth or bone. So we're going to see that the lasers that we're going to talk about in this lecture is really just a soft tissue laser. So they can be used in periodontal therapy, and they're going to play a crucial role because they're precise. And since they're so precise, we can use them on minimally invasive treatments like laser troughing, like frenectomies, like cuspid exposure, even biopsies or aphthous ulcers. We can still use it for all that. And they're going to provide the ability to target and remove diseased tissue while preserving healthy tissue. So let's think about that a little bit. How does a laser remove diseased tissue but preserve healthy tissue? Well, the light, depending on the wavelength that the laser has, is going to be very specific to where it's going to have higher affinity. If we have a laser that's 810 nanometers, like the one that we see in this slide, this diode laser is going to have a higher affinity for pigmentation. So anything that's darker, it's going to be able to focus that light or kind of grab that light energy a lot more than the surrounding tissue. So when we're talking about diseased tissue, that energy, let's say it's diseased tissue inside a sulcus, and that laser energy is actually going to be more attracted to those darker areas, to that diseased tissue. So it's going to target it and remove it, while at the same time it's going to preserve the healthy tissue. But it doesn't only preserve it, not only does it not damage it, it actually aids in the reduction of bacteria and promotes faster healing. So it does this in two different ways. The first way that it does it is by removing that bacteria. So if you don't have an infection, you don't have those neurotoxins, you don't have that chronic inflammation, that's going to help the tissue heal. But it does something else that's super important, and that is called biostimulation. So low energy lasers, like the one that we use in dentistry, these diode lasers, they actually stimulate these fibroblasts. So we know that fibroblasts are responsible for producing collagen. These fibroblasts are responsible for the healing process that our body does. So if we're using this laser and we're promoting the healing or the reproduction of collagen by these fibroblasts, it's going to induce faster healing. So first, we're creating this great environment where there's no bacteria anymore, or very little bacteria because we're reducing it. But at the same time, we're also telling the cells that are responsible for healing, we were telling them, hurry up, let's produce more and more and more collagen. Let's heal faster. And this is something that's going to be used over and over again when we're talking about periodontal therapy again, because not only does it remove these bacteria, but it's also helping this tissue actually create a faster and stronger attachment, clinical attachment to the clean tooth now. So it's going to be able to reduce these periodontal pockets. So just overall, lasers enhance the efficacy and patient comfort in periodontal care. Patient comfort because we said that it's going to promote faster healing. It also does blood coagulation, so the patient's not going to bleeding everywhere. It also does nerve ending cauterization, so we're not having all this inflammatory neurochemicals being flooding all the mouth and causing all this swelling or inflammation, because the laser is taking care of that. It's closing off all those blood vessels, it's cauterizing all those nerve endings. And by doing this, we are able to have lower inflammation, faster healing, and just increase patient comfort. So I said that we're going to be focusing really on periodontal therapy for this course. But I did want to share one slide with you for all these other procedures that can be done when we're talking about lasers. So these are the ADA codes that we have on the right side. We can do gingivectomies for both periodontal or restorative. Frenectomies. Frenectomies are something that's huge. It's something that's done quite a bit with these diode lasers, because we don't need to suture. There's no bleeding. The post-op is incredibly fast. Nothing compared to an electrosurge or a 15 blade. So it's just super easy and precise. We can do cuspid exposures, even biopsies. But the main thing is going to be the laser bacterial reduction. which is what we're going to be talking about. We can also do aphthous destruction of lesions, or decreased sensitivity around the tooth. But again, that's going to be for another course. If you guys have questions on any of these procedures, go ahead and let me know at the end, and we can go a little bit more in depth into them. Okay, so what types of lasers do we have in dentistry? Well, we're going to talk about 4 different types. I said at the beginning, we're going to be focusing on this first one, which is the diode lasers. So why are we using the diode lasers? Diode lasers, they're efficient in soft tissue procedures like gingival contouring, pocket disinfection, but they're known for being extremely precise. And they're so precise that we can use them in minimally invasive treatments. They're precise. They're going to also help us or aid us with hemostasis. And like I said already, periodontal therapy procedures, which we're going to talk about. We also have CO2 lasers. So the CO2 lasers, they're ideal for cutting and vaporizing soft tissue. They're essential in oral surgeries and lesion removal, and they have minimal tissue damage as well. We have the erbium lasers, which they can be used both for soft or hard tissue. They can be used in cavity prep, like in periodontal, especially for lesion removals, periodontal pocket refinement, and also they also promote faster healing, like I said, that lasers do. And finally, we have the YAG lasers, and these can penetrate deep tissues. They're great for periodontal therapy, including reducing bacteria and aiding in tissue generation. But these other lasers, they have more disadvantages than the diode lasers, which is why they're not as common when we're talking about soft tissue lasers. They're not as common in dentistry. The first thing is, let's talk about the wavelength. So when lasers have a longer wavelength, that's going to limit how precise they are. So not only how precise they are, but they're also going to limit hemostasis. And this is because the wavelength is directly related to what that light has affinity to. Remember at the beginning of the lecture, I said that the 810 nanometer wavelength diode laser, they're going to have a higher affinity to pigmentation while still maintaining some affinity to water. When we have a higher wavelength, they're not going to be able to focus so much on that pigmentation. So it doesn't make them as effective. They're also going to be limited because they're not precise. So they're not going to be as precise as the diode lasers. They're going to be more bulky. They're a lot bigger, and also the cost is going to be higher. So that's why I like using the diode lasers. It's like you saw on the slide. It's the size really of a Sharpie. So it's extremely portable. It's wireless. So it just has overall for dentistry. That's why most dental offices have these diode lasers. So let's talk about the advantages now of these diode lasers in dentistry. Like, what can we use them for? Well, they're very versatile, right? So we can use them for all those procedures that I showed you, plus more that I showed you in that slide. They're precise, extremely, extremely precise. They help with hemostasis. So let's say you're doing preps of canine through canine and you have bleeding and now you have to pack cord. Well, if you have the laser, you can do laser troughing around those teeth. You can help with hemostasis, and now you can take your impression or your scan. Where else does hemostasis come into play? Well, let's say you do your periodontal therapy or your SRPs, but then you want to do some restorative work afterwards too. There is always so much blood in those patients. When we take the laser and if we pass it through every single tooth, it takes about 3 minutes, we're now able to have that hemostasis. So that patient is no longer bleeding, which means we can go directly now to do our restorative work right after SRPs. Not only that, but like I said, since there's hemostasis, there's going to be less discomfort for the patient. There's going to be a reduced swelling because there's minimal tissue damage. I already mentioned that they're very compact and portable, and that's going to help with the patient comfort, all that minimized tissue damage. And we're going to have that wavelength precision. And just overall, we're going to be able to enhance our soft tissue management. So why should we use lasers now in periodontal treatment? So this is really the focus of the lecture. Why do we use these in periodontal therapy? Well, We're going to use them because they help us with pocket decontamination. The lasers, they're going to be able to treat and eliminate the bacteria in the gum pockets. And this is going to aid in periodontal disease treatment. Why? Because we know that periodontitis is an infection, and that is how it has to be communicated with our patients. You have an infection in your gums. So what causes this infection? Bacteria. So what do we need to do in order to get rid or control this disease is to kill off this bacteria. How do we kill it? We kill it first by using this laser. Then we're going to remove it we're going to remove all the calculus that you have around your teeth to make sure that your teeth are clean. And then we're going to go through again with the laser in order for us to clean it even more. And I'll show you the process. We're going to see the process in a little bit right now. But really, that's how we communicate it to our patients. We tell them, this is a disease that you have. It's an infection. It's caused by bacteria. So when we use the laser in periodontal treatment, we're getting rid of most of that bacteria that's in those pockets. So that's going to be able to help us restore the gingival health as well. Because like we said, laser therapy is going to be able to reduce inflammation, but it's also going to promote this gum tissue recovery. So why does this happen? Like I mentioned before, we have these cells that are responsible for healing, and these cells are stimulated by the laser. So if we pass the laser through, these cells are going to have a signal to start producing more of this healthy tissue. And it's overall just going to give us a better gingival health restoration. If we have this promotion of a clean environment where there's no more bacteria or very few bacteria, and we have these cells, these good cells that are not producing disconnected tissue, that is going to lead to pocket reduction. And it's minimally invasive because we do have other ways to reduce pockets, and that's surgical. That's when we open up a flap, we clean everything up, we suture it back up, and obviously that's going to lead to pocket depth reduction. So when we have a pocket reduction, we can either use a minimally invasive treatment like SRPs and aiding it with lasers, or we can go with the traditional route, which is SRPs. And then if we still have deep pockets, we're going to do a flap, so a resective surgery, which most patients are not very fond of. So it's going to reduce the pain, and it's going to increase comfort. Why? Because we said that the post-op is going to be a lot better because we don't have all those neurochemicals that are spilling off into the bloodstream, off into our gingival sulcus, and not causing this future inflammation. So overall, they're just going to enhance the SRPs because the lasers are going to help improve calculus and biofilm removal during scaling and root planing. Why? Not only does it soften it up a little bit, but it's also killing off more bacteria that are not going into that bloodstream before we do the SRPs. Okay, so I'm talking about a lot of why it's good to use these lasers in periodontal treatment, but how exactly does this look in their office? And it's going to be pretty simple. All right, when we have a traditional SRPs or laser assisted SRPs, in the traditional SRPs, we're using the instruments that we have, whether it's ultrasonic and then followed by scalers, and then that's it. We might use some irrigation, but when we're talking about the lasers, what they do is that they're actually going to vaporize the bacterial biofilm that's infected in either the tissue of that's surrounding the tooth or in the tissue that's surrounding the root of the tooth. So not only is it going to do that, but it's also going to have this coagulation effect and cauterizing effect. So it's going to stop bleeding and also going to help with those nerve endings. Infection, it's going to reduce the risk of infection because if we have a decreased bacterial count, that's going to mean that we're going to have less infection, or at least a lesser risk of infection. Pain and discomfort, we already said that the SRPs, the post-op pain, is going to be reduced because these lasers are going to cauterize those nerve endings, and it's also going to reduce the sensitivity. Okay, so what does this look like? Let's say you understand already what the benefits are. So how difficult would it be for you to implement this in your office? Well, the good news is it's only 3 steps. And the better news is that one of these steps you're already doing in your office, which is the SRPs. So what does this look like? Step 1, we're going to use a laser around every single tooth. Step 2, we do SRPs. Step 3, we go back with the laser and do it again on every single tooth. Go around every single tooth. How long does this take? Usually about 3 minutes for the laser part. You do your SRPs and then you come back to the laser, another 3 minutes. That's going around every single tooth. It is extremely fast, and in most states, your hygienist can do it. So, step 1, bacterial reduction. Why do we do this? We do this before we start SRPs with the goal of reducing as much bacteria as possible before we go in there with our scalers, with the ultrasonics, and just mess up all the calculus, remove all the calculus. We want to make sure that it's nice and or at least it has a lower bacterial count, because that's all going to go into the bloodstream. Next, scaling and root planing. Traditional scaling and root planing. That is it. And then finally, we're going to finish it up with sulcular debridement. So the sulcular debridement is going to remove the diseased epithelium. It's not going to harm healthy tissue because it's going to focus just on that diseased tissue. And we're going to see consistent reduction of pockets from 6 millimeters down to 2 to 3 millimeters. And that's it. You're done. Nothing else to it. Super easy to implement. And when you explain the benefits to the patient, we have a very high case acceptance. So what are the contraindications and safety of the lasers? The good news is that you can use this on every single patient, from newborn up to any age. There's no contraindication on age limit. There's no contraindication on any diseases. Why? Because this is really just light energy that's being used. The only thing we need to make sure that we take care of is our eyes. So we have to have special goggles that comes with the laser, and we have to put a sign up that says, that there's a visible and invisible laser radiation, and that's it. We don't have to do anything else. The only contraindication is not using safety goggles. So that's it. All right, let's go ahead and see what a case like this would look like. This case is a patient that had just generalized severe periodontitis. We have pockets about 9 millimeters throughout the mouth. And the patient came to my office because she wanted to get an all-on-4. She had already been told at different offices that she needed to get all her teeth removed, implants put in, and she was okay with it. She came in, she was ready to pay, she had the money, and she was just ready to go with the treatment because it was something that she had already studied. But when we talked to her, we saw that she did have bone loss. She had a lot of bone loss, but she had really good roots. She still had good bone levels. So I said, if you're really committed to this, we can probably save your teeth, but you have to be really interested in focusing on being able to actually help yourself. So we're going to do this in a non-surgical manner. What did we do? Laser assisted SRPs. So we did the laser first, then we did SRPs, laser again, and the patient came back 3 months later for their periodontal maintenance. So this kept going, and I also used something else called Peri-Restore, which I'm just going to mention really quickly. So Peri-Restore is a hydrogen peroxide gel that's made specifically for her teeth, and this gel will actually go every single day. She'll put it on at home, and she has to be very compliant. And this gel is going to decrease that bacteria that's actually causing this inflammation. So she does that at home. So what does this look like 6 months later? In a non-surgical approach, we have these 9 millimeter pockets down to 3 millimeters. And I mean, sure, yeah, we have some recession here. We have those black triangles that are even more dominant now. But we also have more clinical attachment to the tooth. So that's going to reduce our pockets, and we have that inflammation is just completely gone now. So this patient is now going through orthodontics, and then afterwards, we're going to see if we do some restorative work for her. But she got to keep all her teeth, and this was in a completely non-surgical manner. So this is something that we can accomplish on every single patient. So just to show you a quick slide about PeriRestore, this is really what it is. This is what it looks like. These are customized trays. We take a scan, just send it to the lab, and they'll make us these trays. And then the patient will actually put this gel, and the gel will go inside. It'll go inside the sulcus into these pockets because they have these reservoirs right here. And that's it. The patient is very compliant, and we can have those great results. And not only that, but it's actually something that's covered by most insurances, where you have these two codes, a D5995 and D5996. You're going to use one code per arch, and you can bill it out to the insurance. So how do we communicate all this to the patient? We said that patient communication was key. We're going to use simple terms that all of us can understand. We tell the patient, you have an infection. So what happens when you have an infection? You have a fever. Why do you get a fever when you have an infection? Because your body is going to increase that temperature and those bacteria are going to die. Well, that is the same thing that we do when we're using lasers. The laser, all it's going to do is just going to increase that temperature, causing a mini localized fever around your tooth that's going to kill off this bacteria. And that's it. So we're creating localized fevers around the teeth to kill off the bacteria. Patients understand this. They know, okay, I have an infection. So how do I get rid of infection? When I'm sick, my body gets a fever. It increases the temperature. Well, that's the same thing that the doctor is going to do now. I have infection around my teeth. So he's going to increase the temperature around my teeth with this laser, and that's going to kill off this bacteria. And that's something that the patients really understand, and it's easy for them to be able to communicate. All right. So we're done talking about periodontal therapy, but when we examine soft tissue, we examine it not just to look for bone loss, not just to look for gingivitis or periodontitis. What else can we look for? What else do we look for when we examine soft tissue? And this is something that I mentioned at the beginning. And we have to be able to look to make sure that we don't have any abnormalities in that soft tissue. We're going to do cancer screening. With the tools that we have now, the technology is so advanced that it's super easy for us to just go in there. It takes 30 seconds to a minute to do a good oral cancer screening with this fluorescent light. And it's going to be able to show us a lot easier if there are any abnormalities. So super easy, portable device that can just be used on our patients. And what does it look like? Well, the top picture, you see just what we would normally see under an exam. In the bottom picture, we see what that tissue that's abnormal will look like under the Visilite Pro. So we do a visual examination first. We do patient history, asking for smoking, drinking habits, and then we do the Visilite Pro examination. With the Visilite Pro, we can see that if there are any abnormal tissue cells, they're going to turn really black, really dark. So that's when we can assess with the fluorescence if there's anything else going on. Now, sometimes there's going to be some trauma. Let's say a patient bites his cheek. It's going to be red. It's going to be inflamed. Well, that's going to show up black too. So we have to be able to assess what we're looking at. We know that if it's something bilateral, more than likely it's going to be normal. But if it's unilateral, if it has borders that are not well defined, maybe we need to think about doing a biopsy now or further testing. So we have the consultation, and again, the great thing about this is that it's something that has an ADA code. So if it has an ADA code, it's because it's going to be for a benefit to our patients, and most insurances actually cover this. In our office, yeah, we bill it out, but if a patient declines it or they don't want to pay for it, we do it anyways, and we don't charge them. Why? Because it's super important for us as healthcare practitioners, providers, to be able to really do our job, which is going to be to make sure that our patients remain healthy for as long as possible. And if that means that we can detect oral cancer, then we need to be able to use our tools, use the technology that's now available, so we don't have an excuse to do it. So if you're not doing this in your office yet, it's something that you definitely have to implement. One of the biggest lawsuits, or the most common lawsuits, is because of misdiagnosing or not being able to diagnose cancer in the mouth. So it's something that's really serious, and it does not take a lot of our time, and it's something that's easy to do now with the technology that we have. Okay, so with that, I just want to finish on a more cheerful note. And it's going to be a final case study. So in this case study, we did laser-assisted SRPs, we did restorative dentistry, and then periodontal maintenance after that. I want you to take a look at a few things. Yeah, this case is a case that actually took 2 years because she underwent orthodontics as well. We see a lot of diseased tissue, not only tooth decay, but we also see periodontitis. We see calculus right here. We see a lot of bone loss, bone loss, bone loss. Same thing over here. We see bone loss and calculus. So what do? This is 2017. Patient went through orthodontics, and we were able to keep everything nice and clean with the lasers in order for us to restore this. So this is 5 years later. Patient came back because she broke this crown right here, and we placed an implant as well. But we can see that the patient had been maintained all this time. She kept coming, doing her periodontal maintenance every 4 months, and using laser. So you might not be impressed by something like this, but let's take a look at this. Same patient. This is the before. This is the after. She had open bite before. We did some overlays on the back, some veneers in the front, some crowns in the front that were splinted. So these two are splinted and these two are splinted. The reason why they're splinted was because I want you to take a look at how much bone loss we have right here. When I saw this in 2017, I said, you know what, this tooth, we should take it out, get you periodontally stable first, and then think about placing an implant right there. The patient said, I don't want to take it out. It's a tooth that I want to keep. If it's possible, let's save it. So we underwent periodontal therapy, laser assisted, and we're able to maintain the bone that we have right here. Yeah, the roots, we had some intrusion there, so the roots are a little rounded off now on all the teeth. But look at the bone level. It's still the same after 5 years. The patient is extremely happy with her smile. She doesn't want to get rid of that tooth. And I don't see, or I don't foresee this tooth failing if the patient keeps coming back, which she does every 4 months. Again, she keeps up with her periodontal therapy. So that leads me to believe that, this is going to be a successful case. It's been 5 years. I don't see this going anywhere for the next 5, 10, 15, even 20 years, as long as we're maintaining this. And the patient knows already the reason why she had all that bone loss was due to an infection. If we're able to treat that infection, there's no reason why we should have more bone loss. So that's going to be the end of this. I want to invite you to the next webinar, which is going to be November 14th, and it's going to be on restorative dentistry. So we see this as a class 5 restoration that we're going to be doing with laser. It's a case that I will show then, and as well as laser troughing for crowns, veneers, everything else that can be used, that we can use our lasers for in our office. In restorative, we're going to talk about that in the next webinar. So I want to thank everyone for joining us. Again, if you have questions that we don't get to answer at the end of today, feel free to either shoot me an email or send me a message through Instagram. And I hope to hear from you and hopefully see you in an in-person course that we'll have, or at a convention pretty soon. With that, I'll leave you with Dr. Levine. Thank you, everyone.
Did you get, there's a special. Okay, so I wanted to ask you about that. So a couple of things. I know that a number of you probably missed my opening remarks. The webinar was recorded. That typically will go out in a day or two. The way that continuing education credits are handled. First off, you had to have been here, so if you've made it this far, you're definitely getting them unless you just logged in 4 minutes ago. But if you're here for the bulk of the webinar, you will be getting an email sometime in the next hour, should be actually in exactly an hour, that will have a survey. The survey says 5 to 7 minutes. It usually takes like a minute and a half, 2 minutes. Fill out the survey. That will send the results off to DenMat. They will then be able to go ahead and issue you the CE. The whole process takes about a week. So keep an eye on your inbox, keep an eye on your spam folders, your junk folders, because a lot of time it ends up in there, but they will go out as long as you're here for the bulk of the webinar. One of the reasons that I like working with companies like TDSC is that they always will offer some type of special for everyone that's on the webinar tonight. As you can see, it's on the screen here. It's basically 10% off of everything in the DenMat catalog. When you spend $200 or more, you see the code there, DEN10. That, or there's a phone number you can call there as well, or just email their support. These are typically time limited. This one's good for about 11 days or so. So I would highly recommend that you take advantage of this because that is a really good offer. So let's get to the questions. Is there anything that you've seen in the literature, Dr. Madrigal, that says that some of these special light-assisted cancer screenings were about as effective as just using normal light, or is there some research that shows that the ones with the special light are better for cancer screening?
They're definitely better. I mean, we can just take a look at what it would look like under normal lighting, which is right here. So it's hands down. I mean, we can see that normal light will not show us everything. When we see this under fluorescent light, sorry about that, fluorescent light, we can see the abnormal cells right there. We can see them turn completely dark, and we can see the contrast. So it's hands down, there's a huge difference between just normal light and using something like the Vislite Pro.
Okay. If someone wanted to learn more about using a diode for desensitization, are there resources online, or are there other courses that they can go to?
There is a hands-on course. If they can shoot me an email or a message through Instagram, I can go ahead and just send them some instructions. It's just a slide that I have in another lecture that I have, and I can go ahead and share that with them.
Okay. So what's your recommendation as far as how the laser is used with scaling and root planing? Are you using it prior to scaling and root planing to soften up the calculus, and then using it again after scaling and root planing is complete?
So it's going to be the 3 steps, right? It's going to be first we use a laser, then we do SRPs, and then we use a laser again. So the first time we use a laser, it's going to be to remove or as much bacteria as possible. So that's laser decontamination or laser bacteria reduction. So first step, laser. Second step, traditional SRPs. Third step is going to be using the laser again, and that's to make sure that we coagulate and cauterize everything, and again, kill off even more diseased tissue or remove that diseased tissue. So it's those 3 steps in one visit.
Okay. What about if you're using it for pocket decontamination? How long does it last for? And are you worried that bacteria are going to just re-enter that periodontal space at some point?
Oh, definitely, yes. The bacteria will always, I mean, we can't keep the mouth sterile, right? So that's why it's extremely important for us to make sure that we communicate that with the patient. You have an infection right here. What we're doing is that we're reducing that pocket depth. By reducing the pocket depth, we can reduce the probability that we're going to have more bacteria there. So this is a consistent procedure. It's not just you come in today and then you're going to be set for life. No, it's you're coming in today. This is a treatment that we're doing. This is what we're doing to help get your mouth in that state of healing. But that healing is going to be a process. It's going to take a while. So I need you to be coming back every 3 months to make sure that we reduce all that bacteria. And then, after a while, your gums are going to be, they're going to be very healthy. You're not going to have that severe infection anymore, but you're always going to be at risk.
Okay. for that previous person I was asking about other courses, even though I think that the live webinars are the best way to learn all this stuff, there are certainly some excellent courses that DenMat has on their site, if on the on-demand courses. So if you just go onto denmat.com and look for the on-demand courses, you will certainly find other courses there as well that you can take at your convenience. On the first case that you showed, did you get any bone regrowth with that case?
The first case that I showed, did we get any bone regrowth? Not bone regrowth, but we did get the pocket reduction because of a stronger connective tissue. So the connective tissue actually increased. Before, the pocket was really deep, and that pocket was reduced by two ways. One, but that we have a better connection now from the soft tissue, and the second is that we did have a little bit of recession too. So bone can regrow in teeth that are closer together. Unfortunately, that patient had large diastemas. So with those large diastemas, it's going to be very difficult for that bone to actually regrow.
Sure. If you're using the laser in conjunction with skin and root planing, do you find that there's a code that you can use to improve your billing, especially for like Delta, for example?
So Delta will not cover it. This is something that we've talked to our patients about. We tell them it's going to be, the way we do it is like we have a fee for the first time that we use the laser. So let's say scaling and root planing, and you can charge anywhere from, let's say, $200 to $400 for the full mouth for that first visit. And then in any periodontal maintenance, you can charge something from $50 to $150 for the full mouth. So that's how we do it. We charge that to the patient. We let them know, this is not something that's probably going to be covered by your insurance, but these are the benefits. It would be this much for the first time, and then for the second time for your periodontal maintenances, it's going to be this much. That's how we communicate with them. So first visit, let's say anywhere from 200 to 400, 450. Second visit or periodontal maintenances, it's going to be from 50 to 150, and you can just choose whatever price you see comfortable in your area.
Okay, so Delta actually says they don't cover any type of laser treatment for patients?
It's going to depend on the plan. It's going to depend on the plan. Sometimes they will deny it, but the way we communicate that with our patients too. So it's going to be very specific to that plan. Some plans do cover it, but they're going to be very specific.
Okay. What about sterilizing the laser after use? What do you wipe it down with?
So the tips are actually going to be disposable. So the tip just gets thrown away. There's sleeves that come with the laser, and then that laser itself would just wipe it off with alcohol, but it's covered. So we cover it.
Okay.
The laser tip itself that gets thrown out.
Okay. Is there a minimal depth of pocket that you would use a laser with? That anything less than that, you just don't find it really does much?
Really, any pocket that has a gingivitis, it's going to be beneficial to it. So any patient that has gingivitis, they're going to benefit from the laser.
The ones that you were showing, does it have like a setting for perio pocket therapy?
Yes. So those that was the NV Pro 3. So you see that one right there in the middle of the slide right now. That's from DenMat. So that has actually presets. So it has 13 presets, and those presets also include bacterial reduction, bacterial decontamination.
Okay. Does it come with different lengths of tips? Because obviously deeper pockets need a longer tip.
Yeah, so they come with a 5mm and a 7mm. So for deeper pockets, we use a 7mm. For regular cases, we just use the 5mm.
Okay. Someone was saying that sometimes they found to be effective. I don't know if you've ever done this, that they sealed the sulcus after LAPT in skin and root plane by pinching the gingivitis with your thumb and forefinger. But I guess a lot of people don't do that as well. Have you done anything like that, or have you found any value in that?
I mean, I do that sometimes when I do extractions, especially when I'm trying to regularize the bone a little bit more for all on fours. But for after scaling and root planing, yeah, you can do that, or you can use maybe some hydrogen peroxide to help with the bleeding. But overall, those tissues are going to be bleeding. If you're using the laser, you get rid of all that problem, and it's going to be more effective, not only because you're causing all that coagulation, but you're also cauterizing those nerve endings, and you're decreasing inflammation. So overall, just, yeah, you can definitely do a manual to stop the bleeding maybe, but that doesn't have the same benefits as using the laser.
Right. Have you found any insurance companies pay for LBR or LAPT?
There are, yes, there are a few. Again, I can send you the list of the plans that we have here. I'm in California, in the Central Valley of California. I can send you the list of the insurances that we have that do pay for it. But most don't. So it's just a matter of communicating with your patients. You tell them, this is the benefit, this is what it is, and you get really good patient acceptance when they understand why they're getting the treatment.
Yeah, I agree. Well, I had said I wanted to be respectful of everyone's time, including yours, and we are at the top of the hour. So I'd like to turn it back to you for any parting thoughts, and then we'll call it a night.
Okay, I just want to thank everyone. Again, if you're using lasers in your office already, or if you have a laser in your office, I would say start using it. You will see the benefits in your patients. Your hygienists will tell you the benefits that they see in their patients. So if you have it in your office, start using it. If you don't have one, look into it a little bit more. And again, I'm open to help anyone that has any questions afterwards. Feel free to contact me, and I hope to see you guys soon. Take care.
Well, thank you for that. Maybe you want to put your the specials up there. Everyone saw that, but there's Dr. Madrigal's contact information there on Instagram and his email address as well. As a reminder, the special tonight is basically 10% off if you spend $200 or more on anything in Denmark's catalog. We thank TDSC for not only bringing in Dr. Madrigal, but also offering that special for everyone. I would certainly encourage people to take advantage. As I mentioned, it's usually only good for about 10 days or so, so please take advantage of that. We thank Dr. Madrigal for sharing his expertise with us. I'm always pleased to have him here because I know we're going to get a good turnout. We always have 600, 700, 800 people here. So thank you for joining us. And we thank all of you as well. We know your time is valuable. We do these webinars on a regular basis. All of you who were here this evening are part of the invitation list for future webinars. So keep an eye out for that. As a final reminder, if you missed part of the presentation or wanted to review it, it has been recorded. That link should go out in the next day or two. In about an hour, you will receive an email follow-up with a link to a short survey. It takes a minute or two to fill it out. You have to fill that out in order to get the CE certificate. So when you get that, just fill it out. It'll go off to DenMat. They'll make sure that you were here for the bulk of the webinar, and then those CE forms will go out. But that does take on average around a week or so, just because, like I said, there's hundreds of people here. So please be patient. Keep an eye on your junk folders. For some reason, they always end up in there. But if you don't have it, say, by Wednesday of next week, by all means, shoot me an email, and I'll follow up with them to make sure that they're going out. Please stay safe and healthy out there. We look forward to seeing you all on our future webinars. Good night, everyone.